Welcome to Habitual Excellence presented by Value Capture. This podcast and our company helps you and your team achieve habitual excellence and get better every day by focusing on one clear goal, one set of values, and one way of working. In simple terms, we want to help you create more value by providing the best care and the safest environment for both patients and staff. To learn more about Value Capture and our services, visit www.valuecapturellc.com.
All right, listeners, welcome to what I think will be an exciting and interesting and insightful episode of Habitual Excellence. I'm here with Robert Mandel, Dr. Robert Mandel, who is the President of Clinical Excellence and the Chief Medical Officer for Carelon Health. Robert and I have known each other and sort of been in the habitual excellence value creating work at different points for 2 decades now. And this is a leader who has used the principles from beginning to end and continues to make really good things happen for people wherever he goes. So, Robert, welcome to Habitual Excellence.
Ken, thanks so much. It's really a pleasure to be here. It's hard to believe it's been 2 decades. I'll try to put that out of my mind, but I'm excited to be here to join you.
It has been. And for maybe new listeners who don't know me, I'm Ken Siegel, and I'm the Chief Relationship Officer for Value Capture and one of the founders of the firm. So, Robert, we want to talk about the opportunity that Carelon has and that you see and that you've embraced to make a pretty incredible impact across tens of millions of people using the principles. And your new position represents that in a certain way. So can you start but let's work our way there. Can you start by introducing yourself and tell us your background, how you set out in your career and what brought you to this moment as the chief clinical leader for such a significant firm?
Yeah, I'm happy to do that. And obviously you just told people what my current title is, but I started out practicing medicine as an ophthalmologist. But I think I always felt like I had an opportunity to make a bigger impact. And so after about 7 years, decided I was going to move into a different part of healthcare where I could have a bigger impact, and started out in a healthcare system, hospital system, with a number of physician practices. And as I did that, got a master's in business administration just to help me understand business more effectively and the ability to communicate in the business world more effectively. And then I worked for that health system for about 6 years, and then spent probably 13 years at a couple of different Blue Cross Blue Shield plans, not-for-profit Blue Cross Blue Shield plans, who I think were also working on how to drive better performance in the healthcare system. And that was typically where I focused my energy, on performance and how do we as a health plan accelerate improvement in performance of the delivery system and ensure that our members and physicians, patients are getting the best care they can get. After those 13 years, I spent probably 6 years in a couple of different startups who were addressing that same challenge of how do we improve healthcare for patients in different ways. And then ended up after that joining what was then AIM Specialty Health as Chief Medical Officer. And AIM Specialty Health is a company that has subsequently evolved into Carelon Specialty Care Services and a couple of other things. But basically, it's a company that tries to ensure that patients are getting safe, evidence-based care that is appropriate and will support improved outcomes for them. But also, when we do that, we know that it improves affordability because we're eliminating a lot of the unnecessary or inappropriate care that tends to be delivered in our healthcare system. So that's how I ended up here. And as AIM has evolved and we were purchased, or AIM was purchased by what was then Anthem back in 2007. Lots of evolution. Anthem became Elevance, or the corporate umbrella became Elevance. They formed a healthcare services company now called Carelon. And AIM, the former AIM, is now part of Carelon as Carelon Health, which consists of 4 verticals. One's behavioral health, one's specialty care services, one's care in the home, and the other is clinical care services. And clinical care excellence sits under all of those as the foundation for those pillars, making sure that every program and every service that we deliver is founded on strong clinical, on a strong clinical foundation.
And this is a new position for the company, right? And you were explaining to me that it really isn't just a nice thing to call a box beneath all those good words, but a fundamental bet that there's a strategic opportunity to sort of center what happens across, this increasingly integrated operation for an increasingly integrated American healthcare system, or at least trying.
Yeah.
That a clinical lens is at the core. So could you talk about that opportunity that Carelon sees and how you intend to go about putting that together?
Yeah. So I think we believe that one of our opportunities to differentiate is in the depth and breadth of our clinical expertise and how we deploy that to support providers as they deliver care, but also to engage members and then really support the provider patient, I should say. Excuse me if I use member and patient interchangeably, it's from my lens, but anyway, support that physician-patient relationship as much as we can. And we recognize that a patient's participation in their care is critical for them to get the best quality and the best outcomes out of their care. And 95% of what a patient does, they do on their own without, interacting right that minute with their provider. And so how do we support that 95% of the time, or help the provider expand their impact over that 95% of the time that the patient is sort of managing on their own, if that makes sense?
Yeah, no, it totally does. And what I hear and what I want to sort of tease or invite you to talk a lot about is I think we all know for the last many decades there have been tensions across the healthcare world between payers and providers, between patients and payers, between patients and providers. I mean, it's really, there are challenges. So what I hear is you see an opportunity to actually make it better by pulling people together around their interests and making it easier for everybody to get what they really want out of it. Is that?
Yeah, I think so. And part of it is, what people want, I think, is the best care they can get. I think part of the challenge is defining that and sort of having people have different interpretations of what that is.
Right.
And so by really creating a strong foundation in the evidence basis for care, we try to sort of take away that confusion. And, so we have strong information and data that backs up sort of our approach, and it's based on exhaustive review of the literature. Yeah. And so the conversations we have with providers about what we think is appropriate in general are reasonably cordial, and we tend to come to an agreement. And now we have guidelines, and they're called guidelines because that's what they are. And so we want to make sure every patient is considered individually. And so we have a lot of conversations with physicians if it doesn't appear that they're following the guideline, to understand what might be unique about that patient that would make the guideline not quite as applicable. So, but in that way, I think we view ourselves as really trying to support providers. I'm not sure they're there yet in terms of thinking about that's what we're trying to do, but hopefully, over time, that's where we'd like to get to.
Right. And thanks for refining that sense of appropriateness and what that really means, because that is at the rub of everything. But I hear you saying the scientific method and evidence-based can be a way toward greater commonality and understanding, and a conversation that allows us to get down eventually to patient by patient, but against an evidence base, and all of that. And did I hear some effort across the company to when we're talking about that care, evidence-based care, or appropriate care, to make it less friction for the different players? Is that part of it as well?
Yes. I mean, as we evolve, we're trying to think about how we make the verification or validation that what's being proposed or what the patient is likely is going to have is appropriate, safe, and that it makes sense, to make that whole sort of validation seamless and almost invisible. Most of the care that's delivered is appropriate, and we're and so 80% of things are done, are appropriate. We'd like to make that minimize the hassle involved in that. And it's the 20% where we want to have the conversation and understand. And I think one of the things we bring to the table, both as Carelon and as being a part of Elevance, is we have data on 100 million patients. Now, we don't know the patient that's in front of the physician at that moment as well as they do, but we do have an experience of what's happened to 100 million patients. And so we hopefully, together with that data from 100 million and the individual patient in front of the physician, can come to the best decision possible.
Well, you've really opened up something that's really exciting, right? Which is what we can learn from these vast numbers of people, of our countrymen and others that are part of the experience database. And I'm sure it's exciting to think about that and enriching a conversation by helping everybody see deeper. And so can you talk a little bit more about the company's hopes for tapping into that vast knowledge, but also, making a difference for a substantial portion of the American public that you now touch in one way or another today?
Yeah, so I think obviously we are getting better and better as an industry in taking advantage of all of the data we have. The advent of electronic health records and the beginning of the ability to share the data in those records across various stakeholders is making a big difference and will only continue to accelerate. And I think, I want to be careful to say that we view every patient as an individual. And so we're not trying to use data to sort of say, this is what should happen to this patient. But we do think it provides a lot of information that helps us and their physician or care provider make better decisions about them and more informed decisions about the care they should have or what's going to benefit them the most. And so we're really excited about being able to bring that out and, again, partner with care providers to help them deliver the best possible care, which is what they want to do, which is what we want to do, which is what their patients want. At the end of the day, we all want the same thing, I think.
Right.
But if we can focus in on how do we get the best outcomes for patients and all align on that, and then try to make the other stuff that helps us do that work, I think we can really make significant improvements.
Right. If we can agree that we're going to continue to have differences of opinion about the money at different levels or try to get it aligned or things like that, but we can really partner fully together on getting the right thing done for the patient. It's exciting. Well, Robert, you made a pretty hopeful assertion, which is that we've gotten better across industry at learning from all of the vast data that we're getting, and then applying it into the care of individuals. And that was a great caveat about viewing the individual as an individual. Thank you. Can you back that up, though, with some examples? I mean, again, you've been leading this work, and you were very modest as you introduced yourself, but you have been at the forefront of some of the breakthroughs of creating better outcomes for patients and better value in the healthcare system. So when you say we've gotten better, can you talk a little bit more concretely about some of the things you've seen that, the audience would say, yeah, wow, that's good.
Yep. So, one of the things we're using this vast amount of data for is to create predictive analytics that help us identify members/patients early, either predicting a risk, like they have a high likelihood of ending up in the hospital in the next year or in an emergency room or whatever, and then being able to reach out to that patient or member, understand sort of what's creating the risk and sort of help mitigate those. Hospitals are great when you need hospital care, but if you can not go to the hospital, you're better off. And so really helping people avoid hospitalizations where we can is really important. So that data helps us drive really sophisticated predictive analytics. The more data we have, generally, the more accurate the predictive analytic is. So that's one of the things we're using it for. We use it for identifying people for different care management programs. How can we support somebody with diabetes, or who are the people who most need the support? And then also, who are the people who are most willing to be supported, so that we're make sure we're focusing our resources where it's really going to make a difference. if that makes sense.
And it
Yeah.
sounds like you've been encouraged by the increasing accuracy and ability that you've seen. Are you being encouraged by some of the results you're seeing of applying that insight to reach the right people at the right time? Because, we can reach them, but then we have to actually cause the change to happen.
Right,
So.
right. So we do see a number of our programs where we are interacting or reaching out to what we've identified as the right people, and we see reductions in emergency room visits. We see reductions in hospitalizations. One of the programs that's most fully developed right now is our oncology medical home, where we have both a member engagement, navigation component, a provider enablement component, so supporting the providers, and then supporting the relationship between the provider and the patient. And we've seen in that program where we've brought all those together, a significant reduction in emergency room visits and in hospitalizations, either related to just untoward reactions from a drug, or the patient just not having someone to reach out to, or not being able to get connected to their provider when they need to talk through a problem they're having, as opposed to going to the emergency room. So, the predictive analytics help us identify those members who are at risk so that we can reach out in advance, and we are seeing an impact from that.
That's great. And that's got to be some of the stuff that gives you energy to keep going as you try to do difficult things across many different partners and payer and organizations.
Yeah, and Carelon Health is really focused on patients with either complex acute conditions or complex chronic conditions, both of which I think our health system struggles to serve well because of the fragmentation, silos, and a variety of other things. And so trying to stitch the system together to support an end-to-end patient journey, again, trying to support providers, not trying to do this as the health plan or as a healthcare services company that's supporting health plans, but as a way of supporting providers in making sure their patients are getting the best care and outcomes. So it's really exciting to see that kind of approach for these kinds of chronic or complex conditions where, in my experience, we just don't do as well as we could, and I'll really improve that.
That's great. Quick follow-up on the substance, and then I want to ask you one more at the principal level that we share. So, Secretary of Health at a state level made an interesting point as a physician recently that part of why he believes, based on evidence, our health system struggles to provide better care for people with complex conditions is that we try to make the health system itself do a lot of the lifting, that in other societies there's a heavier investment in social services. So some of the money is transferred from the direct services to those things that people need to get to the appointments and be cared for effectively in their home, et cetera. Do you see hope for this kind of thinking to go beyond even the what people might be imagining in their minds? It's still primarily between healthcare providers and members, or does that insight strike you as true or relevant?
Yeah, well, I have limited experience, but it does strike me as true. I have one recollection of a visit to Sweden where we were talking with the county, or I think that's what they call them, county health system.
Yeah.
And they were talking about the fact that, for when they notice a lot of people coming into the hospital with motor vehicle accidents from a particular traffic intersection, the solution isn't to keep taking care of the patients in the emergency room. The solution is to change the traffic intersection. And they have that kind of feedback loop there because at the end of the day, the county's responsible for all of those costs. So it's a little bit more challenging here because we don't have that the system connected in that way.
Integration, yeah.
Yeah, but I do think as health plans recognize the issues that drive total medical costs and the fact that they're actually responsible for total medical costs, they are beginning to invest in other things, social determinants. How do you make sure the person's getting healthy food, can get to the store, can get their medications, the things that were not traditional, like health insurance responsibilities. They're thinking much more about those because it really is improving overall affordability by helping patients manage their conditions more effectively.
Yeah. No, that's great. It just, as you start to apply your systems thinking, it's exciting to think about where it could go. And Little bit of a shout out or advertisement for our sister nonprofit, Pittsburgh Futures, which has actually started to do exactly some of this work in the city of Pittsburgh with some great outcomes that are about connecting these systems in different ways based on what the underlying drivers are, which is exciting.
Right.
So Robert, systems thinking, you've always been a systems thinker. You're in a significant position. How are you using your systems thinking and your principle-based thinking about, the foundationally what it's all about and how it has to fit together to lead at healthcare in this time in a really significant spot in a very large organization? How do you apply the principles as a leader? How do you find yourself applying them?
Well, so that's a really challenging question because I don't know that I think about it like that every day.
Yeah.
But I would say that I have a couple of things that I feel are really important in leading any organization, but I could make the case maybe even more important in a clinical organization.
Yeah.
And three of them are about how we engage our associates. And at the end of the day, it's our associates on the front line who are interacting with the providers and the members. And that experience is colored significantly by sort of how they show up. And so in supporting them to show up as best they can or the best version of themselves, I have three things I want to accomplish. And as you know, I borrowed these from Paul O'Neill, who generously shared them with me. And that is, and I will abbreviate them, but to make sure everyone is treated with respect. And there are a number of things go after that, but that everyone comes to work and feels they are treated and respected for the contribution they're making. The second is that we give them the tools and the knowledge to successfully do the work we're asking them to do, and that work adds meaning to their life. So we're giving them something meaningful to do. And part of that is incumbent upon leadership to help them to help tie what they're doing on a day-to-day basis to the bigger impact that we're having as an organization. So, sometimes if you're, handling IT tickets, and that's your job, is to get in IT tickets to correct systems that are helping nurses and physicians interact with providers. You might think like, oh, all I do is stack up these IT tickets, but what you have to make sure they understand is resolving those IT systems allows us to serve our clients more effectively, creates a better provider experience, and it's sort of a virtuous cycle. And so what you're doing is really important, and shouldn't think of it as just stacking IT tickets, or it's more than just stacking IT tickets.
Right.
And the third thing is, making sure they're recognized for their contribution. So by someone whose opinion matters to them. So, making sure that people acknowledge what they're contributing to the organization. So those are three things that I think are critical to making sure that the people that are working for, CCE, Carelon Clinical Excellence, can show up as the best version of themselves. Then there are two. Oh, go ahead. Yeah.
No, you go ahead. Keep going.
So the only thing I was going to say, the two other things that I think are really important, and this is particularly true, and I think aligns with some of the things that you teach about in healthcare delivery systems. And one is raising your hand. So if you see something, don't assume someone else is going to identify that problem. You should raise your hand and identify the problem, and let people know about the problem as early as possible, and not to view that as a weakness. Like calling for help or raising your hand is not a weakness. The second thing is not staying in your swim lane. And this is about feel free to make contributions wherever your experience and expertise allows you to do that, and don't feel confined by the specific swim lane you're in. And the flip side of that is if someone's jumping into your swim lane, don't be offended and view it as a constructive. Someone's there to make what you're doing even better than it is.
Yeah.
So those are sort of the five things that I talk about all the time.
Yeah.
And people say you should limit it to three, but I've gotten it down to five, and sort of that's, and I think I've been pretty good at getting people to internalize those. So
that's great. And how do you do that? You talk about them. That's one way. All the time.
All the time. My leaders talk about them all the time. I have sessions where I have roundtables with associates from across the organization, and I start out talking about those three questions and sort of get their input on where we're falling short and what we could do to make more people be able to answer yes to those questions. And so it is a sort of a framework that I use in a lot of my conversations, not everyone, but almost.
Yeah. Right. Well, that's exciting. So, what are you excited about pushing forward in the next year, and what's your advice to other leaders who are at this moment of tumult and uncertainty, certainly provider systems, but also payer systems, right? How do you approach this moment? And you've got a lot of experience, and what's exciting, what's daunting, and what's your advice?
Yeah. So I wish I had a crystal ball, but I don't. So I'll say that I think the challenges, sorry, the challenges that we have just from a fiscal perspective in the country in general, give us pause about how do we continue to afford to provide the best possible care to all of our citizens. And even more broadly at Elevance, their aspiration is to improve the health of humanity. So a really significant aspiration. And so you think about how do I do that? And part of that is, again, our role in appropriateness is eliminating inappropriate care allows appropriate care for people who otherwise might not have gotten it. So it is about sort of growing the pie in some ways. But I think, we're going to face some significant challenges, and in some way daunting, definitely, but exciting in some ways, because, sometimes out of that kind of adversity, you create innovative solutions, new partnerships are developed, new ways of collaborating come about. And so, I tend to be an optimist. So my view is the challenging time that we're going to go through over the next couple of years is going to lead us to better solutions and better approaches and improve our overall healthcare system. So I'm excited about that. I think, that's one of the reasons I'm excited about being at Elevance. They serve, 45 million Americans. And then a lot of our other clients are other Blues plans. So I think overall we have 60 or 65 million people that we serve at Carelon Health, which is probably more than a third of, insured individuals. So we have a big opportunity to make an impact. We can sort of lead the way. We have to be willing to take some risks and be out there. But I'm excited about doing exactly that.
It's an incredible platform, and knowing that leaders who think like you and have the experience that you do are now being put in position to help lead some of that innovation through the tumult is, I know, encouraging to me. And as other leaders get to know you through this podcast, I'm sure they'll feel the same. Thank you for being with us, Robert. Appreciate it.
My pleasure. I really enjoyed it. Thank you, Ken.
Listeners, for more information about these ideas in general and how they've been applied across payers and providers and the rest of the American healthcare landscape, you can certainly go to our website, www.valuecapturellc.com. Look for Dr. Mandel's work at Carelon and his colleagues at Elevance as well. There are endless resources on the website. Robert, I don't know if there's anything you'd point them to about the new work that leaders might be especially interested in checking out.
Yeah, we do have it, and maybe I can attach it at the end of the podcast. Yeah. I may not know the link directly off my mind, but we do have an improving, I think it's called Improving Healthcare 3.0, but that may not be the exact title, but I definitely can get that to you.
We'll Improving Healthcare 3.0, and we'll put something in the show notes if that's not it, so that people can easily find it. Terrific. And remember to like and subscribe to this podcast if you haven't already, wherever you do so. And we'll see everyone next time. Robert, thank you for being with us.
Yep, you're welcome.
Thanks for listening to Habitual Excellence by Value Capture. We hope you'll subscribe to the podcast. Please also rate and review it in your favorite podcast app. To learn more about Value Capture and how we can help your organization on a journey to habitual excellence, visit our website at www.valuecapturellc.com.